Thank you for joining us virtually for a press briefing. My name is Kelly Chandler. I am the Public Health Division Manager for Itasca County. We are hosting press briefings in Itasca County every other Thursday to address questions and needs in Itasca County related to COVID-19 shared with us by our community. Today we'll be addressing mental health and how to cope with changes related to COVID-19, as well as discussing flu season as this is upon us. I will begin with discussing the flu season. Flu shots are so much more important now than ever. Getting a flu shot lessens your chance of contracting the flu, but also lessens your likelihood of getting serious disease. Meaning, if you have a flu shot, even if you contract influenza, your likelihood of ending up having illness that you cannot manage at home or have to be treated in a hospital is lessened. We do know this based on studies from past influenza seasons. We want to keep our hospitals open for COVID patients and any other critical health needs, and getting your flu shot is one thing you can do to help stay healthy yourself and keep hospital beds open. And that brings me to the frequently asked question about local hospital capacity. I have been in contact with our local hospitals to inquire about their capacity and availability. They're all working regionally to manage patients needing hospitalization for COVID or other serious health issues. Our local hospitals all have the ability to admit and treat COVID-19 patients, but that being said, our hospitals monitor availability of beds daily, both in the region and the state, and the overall goal is to assure patients have the right care when they need it, and that may be regional care or it may be local care. Providing actual real-time numbers of hospital beds is difficult to provide at any given time, as hospital capacity changes on an hourly basis, but we do want Itasca County residents to know that hospital beds are still available right now, and we do want our community to stay as healthy as possible, so we do not need to fill hospital beds and can keep them available for COVID patients who need critical care. I will turn back to our focus on mental health and COVID. This pandemic has been a marathon, and we've had to adapt to a significant amount of change. We've had schools closed last spring, we've had stay-at-home orders, we've worried about running out of basic products such as canned goods and even toilet paper. We've had employers close their doors for a period of time and more people on unemployment. Moving forward, we face uncertainty about learning models in schools and the future of extracurricular activities such as sports. And I don't want to focus on the negatives. I want to point out that change is hard and uncertain. It creates stress and maybe compels us to act and speak in ways we normally would not do. We need now more than ever kindness and to treat each other with grace and understanding. Kindness not only promotes our own mental well-being, it promotes the mental well-being of others. Our mental health is so important to our physical health and helps us interact with our family, friends, our workplace, and even within the community. Our speakers today will be focusing on mental health and coping. We will be joined by Tom Gaffney, Crisis Team Coordinator for Itasca County, First Call 211, Dr. Bruce Chenenbaum, Psychiatrist at Grand Itasca Clinic and Hospital. And when we move to the question and answer portion of this press briefing, Monique Fox, Administrator from Essentia Health Deer River, Angela Clefman, Chief Operating Officer from Big Fork Valley, and John Pedersen, Senior Director of Support Services, Grand Itasca Clinic and Hospital, will be available for that portion. Before we move to our speakers, our Itasca COVID-19 numbers are sitting at 627 cumulative cases as of this morning. 223 of these were identified in the last 14 days. 129 have been identified in the past 7 days. Our 14-day case rate per 10,000 for schools as of October 11th is sitting at 52.4. This does push us into a direction of looking at less in-person learning opportunities and activities for the schools, but we have the power to change this in Itasca County and bring these numbers down. And we are asking each person in Itasca to do their part. Stay 6 feet apart, wear your mask, and avoid gathering in groups. I will now introduce Tom Gaffney, Crisis Team Coordinator for Itasca County.
Hello, my name is Tom Gaffney. I work at First Call for Help and the Itasca County Crisis Response Team. And one of the things I've thought about is First Call for Help. The name indicates something that is a reality. First Call for Help really is a place where you can call and you can get some direction as far as what way to go, whether it's accessing insurance, accessing mental health providers, physicians, informal support, So it's a great resource just to give you a little bit of direction, because that's such a difficult time, especially when we're a little more isolated. We have difficulty knowing what direction to go without being able to just talk on an informal basis with friends, family, that type of thing. So it may be helpful in that. The other thing that's really helpful that First Call for Help has is a website that's called Stable Embrace that goes through many different coping avenues that may be helpful for family, friends, kids, parenting, that type of thing. The pandemic has impacted us in many ways, and you people know that, but one of the things I've thought about is how almost insidious or sneaky it's affected us. And I think about things like going to grocery stores, and it's more difficult to just socialize informally, even if it's for 2 or 3 minutes. And that impacts people tremendously. The crisis response team, we've seen an increase in, since school opened up, we've seen an increase in contact with students and with school professionals that are calling in for support, which is a good thing. We've also had an increase in suicides since the pandemic hit, and it's affected people with standalone mental health issues and also with chemical dependency issues. In the state, it's gone up 32% as far as suicide rates for people with mental illness or people with issues related to anxiety, stress, and with people that are having issues related to chemical use. It's gone up 38%. And that's the Minnesota rates, and Itasca County mirrors those increases. So being conscious of what our friends and family and even people that we don't know are needing. Kelly started the program off by talking about how important it is for us to be kind and considerate of each other. And as our stress increases, being kind to other individuals makes it more difficult. So those are some thoughts I have. Thank you.
Thank you, Tom. And I will now introduce Dr. Bruce Chenenbaum, psychiatrist at Grand Itasca Clinic and Hospital.
Hello, thank you. I'm a psychiatrist. I work with all ages, youth and adults, and there's no question that the stress of COVID-19 has affected a lot of people. Psychiatry is already underserved almost everywhere, and we're more stressed, and it's very encouraging to hear support services that are available, and connecting with people is maybe the most important thing when you're having trouble. So keep connected, don't isolate, that's the most important thing. Some of the things we're going to see in terms of changes, I think with children, especially young children and then adolescents and older children, you can certainly expect changes to take place. The younger kids, you're probably going to see more behavioral issues. That's also especially true with any children that have problems with anything in the autistic spectrum or neurological disorders, even ADHD, ADD, those are neurological. All those things will be exacerbated. But it's going to be very important to understand that we're going to need to create more structure, new structures, and new routines. It's going to be very important. And with older kids, we often will see behavioral changes, but more perhaps in terms of withdrawal, isolation, less interest, more irritability. And I could certainly go over even in more detail when we have some time, talk about some ways to approach. But I think the most important thing to keep in mind is with the younger kids, you really want to validate their experiences, not explain things away, but validate that it's understandable what they're feeling, their feelings are real, address the issues as needed, answer questions age appropriately, but also you want to what we call curate or edit information they see. So don't leave the TV on all day. You can let them see some information, or you can watch it and share with them. With the older kids, you're going to need to give them more time, especially adolescents. They always need some time, but they're going to even need more time, more alone time, maybe some private time with either parent. And also, you may see their behaviors also be more withdrawn, more erratic, and you want to be a little more patient. So those are some of the principles. In terms, just real quickly, in terms of depression, we may see changes in appetite, increase or decrease, increased sleep, increased irritability. Young people tend to have more irritability than they would have necessarily sad feelings. And then in terms of anxiety, we're going to see more physical complaints, upset stomachs, headaches, just restlessness, nervousness, and all of these things need to be addressed in terms of support, validating, and then helping children and adults learn to modulate their experiences. I think that's probably enough to start, and I can address some more when there's some questions.
Thank you. And we will move into our question and answer portion of the briefing. We ask that the media submit questions via chat and state your name and the organization that you represent. And the first question is from Jennifer Vale Stores from ICTV. What advice would you give to those who have vulnerable family and friends who are suffering anxiety and feel powerless? Dr. Chenenbaum, do you want to start with that one?
Sure, that's a great question. Again, the first thing is to keep connected. That's so important that people to not feel so isolated. Obviously, connecting these days sometimes is through computers, but that's so important. Giving people a chance to talk, just talking about things helps diffuse it. And then if people are really in great distress, encourage them to obviously connect with professionals through crisis lines, or if they have professionals they're working with. Certainly anything that addresses more impairment or more threats should definitely be addressed by a professional.
Thank you. Leah Ryan, Mesabi Tribune, what are you instructing schools in Itasca County to do considering school rate is 52.4? MDH recommends distance learning for all students once rate is over 50. Very good question, Leah. So I am working with all the local school districts as well as a couple of the smaller schools that have less affiliation to a larger district. And from a Department of Health perspective, we don't have the oversight to tell schools to do anything one way or another. We certainly inform them of the information and the case rates. We are a liaison between safe guidance and what they should be following. And what I can say is actually our schools are so on top of it already. They all have a COVID coordinator as required. So they are aware of all the safety measures and they put them in place. As far as instructing them, I'm more of a support person and an informer. I can't tell them to do one thing or another. That being said, if schools have a really good plan in place, they've really thought things through, I will provide extra support to them in their decision making. Jesse Slater, KBJR6, could you please clarify what it means when you say Itasca County mirrors the suicide stats of the state? Tom, can you take that one? You're muted, Tom. There you go.
Thank you. What I mean is the rate in Itasca County is similar to the rate in the state of Minnesota. So the 32 and 38% increase, that's very similar to what's happening in Itasca County. Can I talk a little bit about the first question that Dr. Chenenbaum addressed?
Yes, yes, absolutely. Thank you, Tom.
One of the things is acknowledging the powerlessness that people are feeling, because I think that's global. Everyone is feeling powerless. So when a vulnerable person is expressing their powerlessness, I think it's just like everyone, it's important to acknowledge that and then to move on from there and to try to help them engage in a fashion that they can recognize some of the things they still have some power and control over. Whether it's talking with you, talking with friends, seeing a therapist, physical activity, anything that they have some control or some power over, and then encouraging those kind of activities. Thanks.
Thanks, Tom. Kathy, KOZY, we've heard of pushing and shoving at a local coffee shop because someone wasn't wearing a mask. How do you recommend people handle someone not wearing a mask if it makes you feel unsafe? Very good question. So what we know about masking, recommended whenever you're in public indoor spaces. My mask protects you, your mask protects me. So there's been different levels of adhering and adopting some of the stay safe recommendations. I don't think that's a secret within our community. What I would encourage is, if you're feeling in an unsafe situation, to remove yourself from that situation. Perhaps if it's a restaurant or coffee shop that does takeout, do that. We certainly, it's in the governor's executive orders that it's not our right to tell somebody else or even ask them why they're not wearing a mask. So that's not something we have the ability to do. But certainly when we're feeling unsafe, we may talk and act and speak in a manner that isn't normally something we would do. So when I talked about kindness, understanding, grace, recognize that they may have a reason for that, but also take care of yourself. You have the power to take care of yourself, remove yourself from the situation. And of course, as I believe happened, law enforcement to get involved if it escalates. But use your power to stay safe on your own, do takeout, all of those things, remove yourself from the situation. We had one more question about schools that will follow up via email, and that is in the chat. Other questions? Jennifer from ICTV, how do parents connect with schools while being kind and respectful? Parents, kids, educators are all feeling incredibly stressed during this time. I will ask Tom and Dr. Chenenbaum to speak. Tom, do you want to start with this one?
Sure. I guess one of the things I think about is children in hybrid learning or online learning, is how that puts them at risk as far as being distanced from other students, distanced from family, and also vulnerable to people that want to prey on them. So being conscious of what kids are doing at home, and then attempting to connect with the counselor or the school staff in a fashion that will enable the child to learn more effectively and to maybe decrease their anxiety. And just by connecting with them, by being attentive to what kind of sites they're going online and utilizing, that's going to be helpful for them to feel supported, encouraged, and to learn more effectively.
Dr. Chenenbaum, would you like to add to that? Oh, you're muted.
Excuse me, let me unmute.
Thank you.
Okay, sorry. I think it's also important to stay in touch with the schools via the websites and whatever communication they have. A lot of the schools are reaching out. There's often chances to have virtual meetings, but I think keep connected, look for whatever connections you can keep with the schools, and obviously try to be more patient, more understanding. I think that's true of everything these days. We're all stressed from this, and we can all use a little more kindness and acceptance and patience.
I think that also, I think schools are they're trying their hardest. They're doing everything they can to support kids, and recognizing that we're in this together, and use kindness that Dr. Chenenbaum was talking about and that you've talked about to dictate all of our behavior.
Thanks.
And if I could, am I back on again?
Yes, you are.
I was just addressing the previous question. When people are doing behaviors that bother you, it's always okay to ask politely, would you please put your mask on, or I'm uncomfortable and you're not wearing it. Never talk about someone else. Don't say you do this or you make me feel, but say I'm not comfortable with you not wearing, would you please? And say thank you. And if they say no, certainly don't ask them why. I think why questions are always challenging for anybody, but just say, well, I'm more comfortable. And like And I agree with it, that if you have to, just leave the situation.
Thank you. So we are receiving a question from Britta from the Herald Review. Kelly, you reported that beds are still available in healthcare facilities. Can you report what percentage of patients are COVID patients? I'm actually going to, because we do have 11 minutes left, have our hospital folks provide an update if they have information available. Monique, would you like to start from Essentia Health?
Sure, Kelly. Yes, we've actually been involved. There are beds available currently, but it does fluctuate on an hourly basis. However, what is really nice is that we've been able to collaborate through the Northeast regional calls, where we actually have an Essentia-based patient flow facilitator that actually works and gathers information throughout the day from all the different facilities in the region, Essentia and non-Essentia, to be able to assess the ability to do lateral transfers back, as well as do something what we call swing beds, moving patients to the appropriate level of care to open up beds in the Duluth market for more acute patients. You asked about the percentage of COVID patients. We are seeing an uptick in COVID patients, but that's not what's filling our beds right now. It's patients that have delayed care potentially and need that higher level of care. So on a daily basis, we meet and huddle every day and talk about, what patients we can take back from Duluth, especially if they are from our Deer River, Grand Rapids community, to move them back to a local level of care that we can provide after they've received the higher acute care. So again, moving forward, we continue to work very strongly with each other, and we hope that opens up capacity to provide care in the best place possible. Does that answer your question?
Angela, would you like to go next from Big Fork Valley?
Yeah, Big Fork Valley similarly is collaborating with regional hospitals, although we do not currently have any inpatient COVID patients at this time. We have spent a lot of time working with local and state hospitals to figure out where our patients can get the best care during this time. And we hope not to admit at Big Fork Valley. However, we do have the capacity.
And John from Grand Itasca Clinic and Hospital.
Hi, Kelly. This is John from Grand Itasca. So similar to our friends at Essentia and Big Fork, we are working with our regional partners, and we're working within our system, the Fairview M Health Network, to look at availability for beds and patient transfers. Grand Itasca has historically not taken on a lot of those COVID positive patients because they're a higher level of acuity. However, we do have some in our current beds. It is less than 10% of our space right now. And when you think about our overall bed capacity, it's not a large number. But we are taking patients. We are looking at shifting those higher acuity patients out to our regional partners in that Northeast Coalition. And if they're unable, when we're watching that min track and that bed tracking situations, if those beds aren't available in the region, then we are looking to transfer it in some cases to the cities.
Thank you. Do we have any final questions? I do want to add with the hospitalizations that we do have local folks who have contracted COVID, and some have had mild symptoms, but we have had hospitalizations. We've had ICU beds currently. As of yesterday, we had 10 local Itasca County residents hospitalized with COVID. We had 3 in the ICU. We had an additional death over the weekend, a female in her 60s. So we just want people to be aware that this disease can be mild, but it can be very severe. And we want people to have the best care possible when they need it and where they can best be served. Final thoughts. Remember, kindness, grace, and understanding is important as we're dealing with change. And our numbers are increasing in Itasca County. They have been since late August with COVID-19, and we are asking every single person in Itasca County to do their part. Stay 6 feet apart, wear your mask, and avoid gathering in groups. Thank you so much.
At Grand Rapids State Bank, we've been a trusted financial advisor to our customers since 1914. We're local, community bankers who understand what it takes to manage a business through thick and thin. Grand Rapids State Bank, your community bank, serving people throughout the Northland.